Numbers of COVID patients hospitalized are significantly decreasing across the region, and UPMC is currently treating 155 inpatients positive with COVID-19.
And more locally, there are 17 inpatients at UPMCs in the Altoona region. Our Tiffany Rizzo spoke with a medical doctor to get more information. So Tiffany, what did you find out?
Matt, since the volume is decreasing, UPMC has been able to shut down most of their specific areas for COVID-19 patients. At the peak of the pandemic, hospitals were utilizing just about every unit they had to accommodate the increase in COVID patients. But now that numbers are declining, UPMC and Conema Memorial Hospital are able to shut down many of these COVID-specified units.
We have been successful since our volume has declined in the area specifically for COVID, that we do not have as many areas within the hospital that are specifically related to COVID.
In mid-December, just about every unit in the hospital had COVID patients, and we're now down to one critical care unit that has COVID patients and one med-surg unit that has COVID patients.
But over the pandemic, UPMC Chief Quality Officer David Burwell says he's noticed patients putting off visits to the doctor, causing some to develop other serious illnesses.
Unfortunately, we have seen over the time of the pandemic that people have come in with more severe illnesses because they have not visited either their primary care provider or sought any realm of medical care during the early stages of their illness. And we want to make sure that we encourage people to seek adequate health care, especially in their time of need.
He urges people not to delay their health care and to see your physician if you develop new or concerning symptoms. With the coronavirus seeming like it's going to be sticking around for a little bit, Burrell wants patients to be aware of an infusion treatment called monoclonal antibody as an option to help treat COVID-19.
They can receive this infusion treatment if ordered by their provider within the first 9 to 10 days of the illness, and it greatly reduces their likelihood of developing severe COVID.
UPMC is now receiving more amounts of this infusion treatment to help those in the early stages of the virus. In studio, Tiffany Rizzo, WTHA News.